REMAC year. Maria's going to go through a roll call.
Roll call, yes.
Period.
Period. Robert Winchell. Joseph Schenker.
Here.
Michael Batch. Robert Ackerman.
Here.
Nicholas Alexandru, he asked to be excused. Christopher Graziano. Eric Cohen.
Here.
Mimi Langsam. Kevin Munjal.
Here.
Cindy Vasilios.
Present.
It's pretty good.
I'm getting better. Thanks. Dario Gonzalez. Glenda Seda. Bradley Kaufman.
Here.
Doug Isaacs.
Here.
Nathan Reisman.
Here.
Never sure. Joshua Buckland. Barbara Aziz. Yeah, I thought I saw Barbara.
She's in the corner, but.
She's hiding out. So. Jeffrey Rabridge. Neil Floenbaum's not here, right?
He's replaced.
Yeah.
Well,
It's gonna be somebody else, but I can't change it until after the meeting.
it's not going to be roll.
Lewis Marshall.
Here. It's not a member.
It's gonna be Michael Red Leonard. Michael Hilton. Is Michael Hilton still your alternate?
For now, yes.
Laura Ivacoli. She is here?
Right here.
Oh, hi. Stuart Kessler. Pamela Lai. Here. Scott Chang. Dominic Battinelli. Peter Wire. Paul Barbara.
Here.
David Benelli.
Right to your right.
Celia Quinn. Timothy Stiles. Mark Cantor.
Here.
Sharice Berry. Charles Martinez.
Present.
Joseph Bove.
Present.
Martin Grillo.
Present.
William Fisher. Robert Krupe.
Present.
Jessica Von Voorhees. Here. Arthur Cooper.
Here.
Yadidja Langsam.
Here.
Anthony Shalish. Christopher Sorrentino. Give me 6 minutes to count. Okay, we have a quorum.
Thank you all for coming. First, I'd like to ask for approval for the June 19th minutes. Okay, next, the correspondence report. Before I read the correspondence report into the minutes of this meeting, I just would like to bring up, we've had some correspondence from public notice for our ESU tactical protocols. Those were sent to the protocol committee. They were reviewed by the protocol committee. I spoke to the person who sent in the comments. The comments were along the lines of adding the tactical protocols and kind of blending it with our full REMAC protocols, which was not the intent of those protocols. I think that in the emails that were sent out, there was no real actions to be taken about those comments. Next, so let's see what we got here. So from the fire department, PCR monthly inventory control report for March, May, and June were submitted. The following agencies were non-compliant with PCR form submission. Bayside Community Volunteer Ambulance, Bensonhurst Volunteer Ambulance, Broad Channel Volunteer Fire Department, College Point Volunteer Ambulance Service, Glendale Volunteer Ambulance, Middle Village Volunteer Ambulance, the NYPD Police Relief Fund, Ridgewood Volunteer Ambulance, and Roxbury Volunteer Fire Department. From the Department of Health, the following provider had an enforcement: Stanford Smith, EMT number 168165, forever prohibited from participating in a CME-based refresher certification program. Wow. Which is violation 800.16A, Part 7. He lives in Brookhaven County. We also received a letter from New York Presbyterian replacing Drs. Cordy and Flomenbaum on the Medical Standards Committee by Dr. Wallace Carter. And I received a letter from Dr. David Kugler verifying CME for Gabrielle Paris, a paramedic. The following were sent, agendas were sent out, emails, blah, 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 blah. Okay. Any questions on the correspondences?
I just wanted to add something,
Okay.
that someone passed away.
Yes.
I just wanted to announce, for those of us who knew paramedic Ray Bilkey, who is also a member of New York City EMS and one of our state reps, he was 58 and passed away from 911-related cancer. So I sent out an email with information on his weight and his services. I just wanted to make sure everybody knew, because I know a lot of people in this room worked with him, and he was a really, really good person.
Okay. Just wondered if the council could send flowers or something like that to
Ask him to,
thank you.
Okay. Any additional comments on the correspondence? Seeing none. Subcommittee reports. The executive committee did not meet over the summer. Medical standards, Dr. Benelli.
Thank you. So medical standards met just prior to this meeting. Really, no action items to bring up to REMAC for approval. Both protocol and CNC committees did not meet. We did have a review of the progress and where we stand with regard to the stroke initiative that we've been working on for the past for over 2 years now. There have been some wordsmithing changes that are really for clarification, simplification, and housekeeping purposes only to the protocols that were discussed in medical standards, and it was felt that those changes can be accepted with no further discussion. The ESU protocol you have already addressed, and that's just about it.
Any questions for Dr. Benelli? Thank you. Quality Assurance Committee.
The Quality Assurance Committee did not meet over the summer, and we'll be sending out a schedule of the upcoming meetings for the next 6 months.
Thank you. Training and Education, Mr. Lapp.
Training and Ed met on August 6th. August 6th, we'll call it August 6th. Let's go with that. It's a Monday, right?
Sounds good. We'll go with Monday.
Yeah, it was August 6th. It's the day after. So we revamped the instructor program for lab instructors. We got it approved by the Department of Health. We ran the program over several consecutive Sundays in the summer. The last session was on the 5th. It was a very successful class. DOH approved it. We put 23 people through. And the next project that's in the works is for a CIC course, instructor coordinators. So that's in the works on tweaking that program, adding some new educational methodology, and getting that approved by the Department of Health. We sent up some names to the Department of Health for regional faculty. We are looking to spruce up, to boost usage of REMSCO's LMS, especially in light of the new stroke protocol training being pushed out through there as well regionally. So we will work on sending that out to agencies again. Hopefully, I know we sent it out before the summer, and I think we should probably launch that campaign again. We're looking at becoming a the trainer center for Stop the Bleed. So that's something that I hope to have accomplished over the next several months. We'd like to do train the trainer courses. We want that to be the program that's used in conjunction with the hemostatic protocol. And that said, other than that, the only other big project was participating in the fire department on the stroke protocol, which is going very well, and there'll be more to report soon.
Any questions for training and education? All right, thank you for that report. Regional Council.
Okay. The Regional Emergency Medical Services Council of the City met on June 26, 2018. Following is a summary. Election of officers, Brian Levinsky, MPP, was approved for appointment as an at-large member beginning July 1st, 2018. Members' terms for 4 years ending June 30, 2022. The following were appointed as officers beginning July 1st, 2018. Officers' terms are for 2 years, ending June 30, 2020. Dr. Langston is chair. The vice chair position, first vice chair position is vacant. Dominic Battinelli, secretary. Mitchell Powell, parliamentarian. No new applications for transfer of operating authority or determination of public need were received. There are no new applications for determination of public needs. The Training and Education Committee is working with the CNC Committee on development of call review and long-distance learning. There's announced a meeting to develop stroke training that will be held at the EMS Training Academy July 5th. It was also announced a CLI course would be held in the summer, given that a fall course was being planned. REMAC reappointment of current officers as approved by REMSCO. Joseph Schenker is chair, Jeffrey Rabrich, first vice chair, Bradley Cobb, second vice chair. Protocol revised and accepted by REMSCO. Cloud protocols, New York City, NASA, and Suffolk are working together to decide if the cloud protocols in effect in the rest of the state can be used in these regions. This can be done without joining a large group. Any region can use the cloud protocols since they are approved by CMAC. There's a letter to corresponsor University Aid Training, Inc. from New York City Department of Health Bureau of EMS, stating that no evidence of need was found for a new or expanded course sponsored in New York City. This application for expansion was denied, but it may reapply after 12 months. The following correspondents submitted renewal applications: REMSCO, New York City, specialty sponsor, Institute for Emergency Care Training, Montefiore Medical Center, Training Institute for Medical Emergencies and Rescue, and CUNY, the Borough of Manhattan Community College. And the meeting was adjourned, next meeting to be held October 23rd.
Thank you. Any questions for Dr. Krupe? Okay. CMAC update. CMAC did not meet? So,
Meet
okay.
September 25th.
Excellent. All right, under unfinished business, I just want to bring up one thing. We've been talking about the stroke protocol, and we have already sent our changes to the state, which were approved for January 1st implementation. Within the next month or so, we will need to make a decision as to how long the implementation process will take and when we will need to actually implement this, because we will have to actually vote to postpone that implementation if we're not ready to, we haven't defined thrombectomy capable centers and so on. So that's something that we all should be thinking about. I think that, we have the October meeting. I believe we have a November meeting. By the November meeting, there is no December meeting. We really need to make that decision. So we will, the stroke committee will be talking to the state and finalizing the plan of how we will define thrombectomy capable for now. But that's something we really need to define, because I know that agencies, especially the fire department, is going to have to start training, and if we start training and then there's a delay before implementation, that can lead to some piss poor training. So, yes.
Can I make a recommendation, which is that at the next REMAC meeting, we'll present about the progress and make some recommendations regarding
Right, I think
the
that's
next
a great
steps.
idea. I think that's a great idea. So we can look forward, hopefully, to the next meeting to have some answer. When's the October meeting? We have an October.
October 9th. October 9th, Tuesday, October 9th.
That's great.
Good job.
Brilliant.
So October 9th, to actually have some information about that going forward. Great. Any more discussion on that? Or I guess I brought it up, I have nothing else to say. Okay. New business, I have one piece, and then I'll entertain any additional new business. On August 17th, the bylaws committee for this committee has met to begin to look at the bylaws and review it. The goals of that committee are twofold. Number one, to review our current membership, see if there are people that we need to vacate from seats because they no longer attend. And number two, considering the size of the system and how it's changed over the past few years, to evaluate whether the seats are allocated appropriately and in a balanced way for the entire region, both municipal, volunteer, voluntary, and so on. The first meeting happened. We still need a little more work before there's much to say. We did all agree that we will be appointing or nominating a parliamentarian, but that we haven't gotten to, we haven't gotten you digit officially commit to it yet. But the seats were evaluated, and we've been reviewing how to balance it out. We did have some discussion about making all seats voting members, which according to the Article 30 and the CMAC criteria, that is not a possibility. So we actually do need to have non-voting members from each sector represented to get the information, and the voting members have to be limited to physicians. So anyone who wants to contribute to that, the committee is more than willing to listen to any input.
Who's the chair of that committee?
I chair the committee. So again, this is about the bylaws and how they all fit together. Any questions on the bylaws committee? Any questions about that meeting?
Maybe I want the next meeting to be held.
Yeah, just was, I'm gonna be sending out an email tomorrow to all bylaws members. Please respond so that we can pick some days.
Right. Thank you. Okay, any additional new business? Dr. Barber.
You mentioned there was some new position nominees. I'm looking at the minutes from last minutes, and I see a lot of reorganization of seats with regards to our voting seats. I was just curious about, will there be any formal acceptance of the new designees that are nominated to our committee?
The ceremony?
So,
We're still in the process.
okay, and there's two separate things.
Yeah.
So the process of determining what seats will be allocated and to whom is part of the bylaws discussion, which again requires 3 readings into our minutes and so on. I think you're talking specifically about last
New
meeting.
positions, yeah.
There was a position that was,
Nominated.
No, it's Dr. Sharma?
specifically what are you talking about? Maybe it'll be easier to be more specific.
No. The only position that was nominated as of last June was the position from New York Presbyterian.
Right, that wasn't a nomination to the committee, it was an announcement from Presbyterian stating that Dr. Sharma was going to be their medical director.
Yeah.
When health and hospitals change their physician, the person was nominated
Yeah,
and
that was
demonstrated.
very.
That person doesn't have a seat on this committee.
Okay.
So that's different. If the person had a seat on the committee and we'd have to change the seat on the committee, that would be, yes, we'd have to vote on that and
Is
so
the
on.
person who's coming here getting a seat or becoming a member? Or is there a
I'm not
difference?
sure who you're
They haven't
talking
appointed
Dr. Sharma.
anybody, so nobody's been appointed to the REMAC from
Okay.
Presbyterian. All that Presbyterian did was announce that Dr. Sharma would be their medical director. And that was the only thing. Wally Carter was appointed to the position on the Medical Standards Committee,
Yes.
but not on REMAC.
Yeah, because the seats on REMAC that have Dr. Cordy and Dr. Floenbaum are actually Greater New York seats. I've already contacted Greater New York to ask them who they want to nominate. And if it's Dr. Carter, that's fine.
I'm not questioning the movement of the seats from last meeting.
Okay.
Or the
Just wanted to know.
impetus for the question.
Yeah, we'll just wait.
So, but again, any agency can submit anyone to be their medical director.
In light of the medical director policy that we instituted a couple years ago, is there any process by which they have to attest to meeting the qualifications to be medical director?
That is a good question. I think that we probably do need to verify credentials.
What we've done
Was
is,
that ever approved, though? I mean, I know.
Yeah.
Yeah.
and we changed the
That was
credentialing,
approved and it was actually sent out to the region as an advisory.
That was approved.
Why better?
and we've changed our credentialing administratively to include whatever new criteria. So new doctors that are re-upping, or that are new ones, originals, have to meet the new criteria, and people that are re-credentialing have to meet the new criteria. For most physicians that are in the EMS system, this has not been a problem. So far, we haven't had an issue. I mean, if you'd like, we can put together a list showing names of doctors and, you know, how they meet the criteria. Give it to the QA committee if you'd like to take a look at that. Sorry.
No, that would be fine. I think that would be an appropriate way to move forward. But the question, what's the assignment? The assignment is to assess medical directors in the region and their qualifications?
Yeah,
It's just that they meet the criteria, I guess.
I mean, we don't re-credential them if they don't meet the criteria that this committee set forward, and it's been implemented. I don't know how else to prove it to you.
But before we do that, what are we gonna do?
Well, that's a good question. So David's question, very whisperedly, secretively, was, when we do this, what would we do with the results? So the policy that we wrote, I believe, says that an agency cannot be re-credentialed if their medical director didn't meet the standards. I think that's what we wrote into the policy. Again, I don't know how we want to act on that, or if we want to act on it, or what we want to do.
I can tell you that right now I have one agency that's being held until its medical director meets our criteria. So that's what we do administratively. We don't just approve them.
That's what we said.
Yeah,
I agree.
that's
Fair
just the way it is.
Yes. Dr.
I think it should be an administrative issue, and if there's a problem,
We
the
bring it
office
here.
can bring it here. But I don't think we need a list of everybody and how they got credentialed. We're not gonna do anything with it.
Okay, thank you. Yeah, we
Like
do
the-
abide by what the committee decides.
At the point of appointments, is it only at re-credentialing the agency or at the point that they give us information about a new medical director? Is there a verification step?
Well, it's at every stage. It's either if you're an original doctor or re-credentialing, or if we get the ALS renewal paperwork, we look at the physician that is assigned. It's all the same pool of information, and we have to check everything. If the doctor is not re-credentialed correctly, we contact the agency and the medical director and tell them, you have to do this, this, and this, and they do or they don't. If they don't get reapproved, they don't get the letter to the Department of Health.
I guess the question that Kevin's asking is, do we need to do an assessment of every new medical director? No, did they meet the criteria that we've set forth?
That's administrative function. That's an
That's
administrative function. And when we do that, I don't.
Got it.
Yeah, I
I'm going
mean,
into the
we get the paperwork and we look at it to make sure that, you know,
Fine.
we don't interview the docs, we just look at the paperwork and hope for the
Gotcha.
best.
Okay. Any more questions on this?
Licensed DEA, things like that, so we look at.
All right, any other new business? Seeing none, I will entertain a motion to adjourn.
Well, we have an
Okay, there it
announcement.
is. What?
Announcements.
Announcements work, sure.
We're going to be holding a telemetry, an online medical control physician course on September 13th at the Fort Totten EMS Academy. So if any of you have doctors who are interested in taking it, let us know.
Okay. So, thank you all very much. I guess we're adjourned to October 9th.